And I must say, Dr. Edgar Rodas is truly one of my heroes and will always be one of my heroes. I am so thrilled that he's able to come and speak with us today. He comes to us from Ecuador, and just so you know, these slides are off-center, so I'm not sure what is, at least on the screen. They fine there? Good. Maybe you can have one of your technical people come look because they're not on the screen here. Anyway, Dr. Rodas has many accolades. He trained in Cuenca, but also trained in the United States in surgery. But very early on, he became interested in a global surgery and global medical work. He has been the director of education at the University of Cuenca. He's also been the vice rector at the University of Cuenca. He's gone on to actually even form the medical school in Azue, and has many things that he's done throughout his life. He has had many awards that he has been given throughout his life. And these are just a few. It'd take probably about 10 different slides to put the different awards that he has received about his work. He served as the Minister of Health of Ecuador for a couple years as well. But what I would like to really tell you about Dr. Edgar Rodas is not so much about all the international accolades or his degrees. I'd like to tell you about the wisdom that this man portrays every time I hear him talk. Now, we went for a little ride up to Brighton Ski Resort yesterday, and he skied on his shoes that he has on today. We didn't get skis on, they're just those Sunday shoes. But I brought him back down to meet with the medical students, and he sat and had a very nice discussion, almost like a fatherly discussion. And every time he talks, I write down another quote that he says. He told the medical students, "Do not let the four walls of the operating room limit your view of the horizon of possibilities." This is the epitome of what Dr. Rodas has done throughout his life. For Dr. Rodas, he has traveled to remote areas on donkey, on foot, on plane, to take care of people's needs throughout the country of Ecuador. You'll hear more about his operating room truck. The quick little story he told me when I was visiting in his home was there's one time they were trying to take this operating room truck to a small town. They had the patients all ready for surgery. And he was bemoaning to his wife, "I am so sad, I cannot take my truck there." And she said, "Well, why not?" She said, "Because the mountain is overhanging and the truck is too high and we can't get it there." It's always important to listen to your wife because she said, "Well, dear, don't you know all the mayors of the country?" He said, "Well, yes." She said, "Well, why don't you ask him to blow it up?" So they did. And they blew up the area and he was able to take his truck. Dr. Rodas told me, don't let somebody tell you it can't be done. There's always a way. Well, in thinking about that and trying to find healthcare down in the Amazon where there weren't roads, and how do you get care down there, he went ahead and got money from the country of Colombia and was able to help organize an operating room houseboat down in that area. Well, now this wasn't just getting the money. They had to go, and Dr. Rodas got with the local Catholic priest, got with a surgeon from here in the United States, and they went and mapped the depth of the river to see if the boat would be able to float. He's not just a surgeon. If it can be done, there is going to be a way. This is this boat, the Sunkanua, and so again, Dr. Rodas's comments, there is always something that you can do. And when we're on the boat, one of the patient's families got bitten by a snake. So I thought, oh, geez, poisonous snake, just stay away from that. No, Dr. Rodas goes up, finds the snake, picks it up, and then decides this is not a poisonous snake, we don't need to worry about it. Always going the extra mile. Before I give him the podium, it's Dr. Ron Merrill, who worked with him on, I think, mapping out that river. told a story about when Dr. Rodas was visiting the jungle, and they had to go through an area, and I'd like to read his little comment here. I call Dr. Rodas the Good Samaritan. I was with Edgar when he found Paul in the ward of a little hospital in the jungle. We had to pass through the ward to go to the dining room. Edgar asked me if I had noticed the accusing and angry eyes of the badly neglected 18-month-old. Indeed, I had, and felt very moved. Edgar was not only moved, but he brought this child into his wonderful family. Following this trip in the jungle, he showed up at home and said, "Dolores, look what I brought home." And actually brought a young man home that they nursed back to health and eventually adopted as one of his sons, who is now in the university and doing great things today. Dr. Merrill goes on and says, I remember sitting in Edgar's home with David Sabiston when Edgar introduced the now charming and happy child who climbed into the lap of an usually rather stern Professor Sabiston who just melted. The youngster is now a very bright and growing teenager. He's actually in college now, but he climbs volcanoes all over Ecuador and is doing great work. I'd like to introduce to you Dr. Edgar Rodas. Thank you.
Thank you, Ray. After your kind introduction, I'm impressed with myself. I think it's your friendship and your generosity that make look things different, better. I'm very glad to be here. I think that's a meeting that makes people think, and that's very important. Yesterday, I had the opportunity to talk about my mobile unit and my program at the Department of Surgery of the University of Utah. I presented the facts, the results, more in a scientific way. Now I think I'm going to talk in a human way. Whether I'm going to say why I'm doing these things and the strategies that I have used to make the program successful. A Spanish philosopher, Don José Ortega y Gasset, coined the sentence, el hombre y sus circunstancias, the man and the circumstances, to mean that the circumstances and the situations we go through life have a definite importance of what we do and how we act. I'm going to talk about some of the circumstances I went through life that made me decide to devote my life serving people, which is all about. Donald Lauf, professor of emeritus at Stanford, founder of Interplast, a great person, talks about the peak experience. He says, it's an experience that causes a deep impression in your life that makes you to change your behavior. I will talk about my peak experience. Molleturo is a little town lost in the slopes of the Andes in the Western Range in South America. We used to go to this town to take care of people with the medical students. This town was about 12 hours ride by horseback or by foot. One day, the priest of Molleturo called me and told me that a friend of mine needed me because his daughter, a 22 years old young lady that was pregnant, became all of a sudden very sick. She had fever, distension of the abdomen, and she was getting really in very bad shape. So I figured out that she might have an abdominal disease and infection, probably appendicitis. I took some of my students, carried the instruments to do on the local, probably a draining of the abdomen to transport her to the city, and they started around 5 o'clock in the afternoon the way to the mountains by horse. I remember it was a beautiful night, a cool August night. August is cool in the southern hemisphere. And the moon was bright, the wind was blowing, and we were thinking all night while we were going up the mountains what to do. We arrived in the hut about 6 o'clock in the morning, and unfortunately, we found the young lady dead. She was still warm, but she was dead. I listened to the womb to see if the baby was still alive, but was also dead. The priest put on a black poncho, said the funeral mass, and we turned back to the city with a very sad heart. This incident made me to realize how abandoned were people on the mountains. For this young lady, it didn't matter that the government had built a new hospital in the city just about 50 miles away. Didn't matter for her. Access is the problem. That's what I realized. Access to medical care. We can have the most developed medicine in the country, but if there is no access, the people cannot reach there for different reasons. So I decided that day that I will devote my life to go to the most distant places in the country to serve the people. This is one of the experiences. There were other experiences. Project Hope, as you know, a Ship Hope, a hospital, visited my country when I was just graduated from medical school, and I served as an intern at the hospital. I was impressed of the way that American people, nurses and doctors, took care of the patients. If there was another program, Interplast, founded by Donna Lau, that until 2 years ago, they have had about 170,000 operations all over the globe, about 1,500 missions, and they have branched in many organizations that came from this inspiration, one of them mine. And I saw these people from the States taking care of our patients like they were their own people, and I thought that us, as Ecuadorians, had the obligation to do at least the same things for our own people. I have had also other circumstances in my life. I was born in an honest family with strong moral principles, grew up in a little isolated city in the mountains with strong values from Spanish and Indian heritage. And so all the circumstances helped me to do the things I'm going to explain to you. I was thinking that the problem was access. I could develop, maybe do an operating room in a truck and go to every place. An operating room is relatively easy to arrange in limited space. The spaces for care of the patient, for preparation of the patient, and for post-operative care are also easy to prepare. It's not any complication, so maybe we should do that. Of course, this idea sounded crazy for my colleagues. They thought that the patients were going to be in danger, that the infection rate will be higher. We said, well, I think that the germs in the communities are not as bad as in the clean corridors of the hospital. And now, after 7,000 operations, the results show that I was right. How to do this? I thought that it's very important to have first an organization to back you up. It's not any project, it's very bad to try to do by yourself. I think you need support from people. You need an organization to back up. You need a team to work with you. You need to have a program, and you need material resources, of course. Unfortunately, most of the times, people start the projects with the last thing I have mentioned. It's very important. You need to have, but it's not the most important thing. I think that organization, a team, and the program are far more important than the material resources. Next. About the organization, we decided to organize a non-profit institution that we called Cinterandes, Interandean Center of Specialties, who has to have a mission, a vision, and has to have some principles and values, as you know, in every institution. Next, we define our mission as our vision as a non-profit organization whose goal is to provide surgical care and other services leading to human development to the most remote places in Ecuador. The mission was to carry out these programs in the most remote areas of Ecuador, and now we are thinking also to expand to other places in the world because we are convinced that that's a very good system and can reach to people that otherwise don't have a possibility to be taken care of. The principles and values, I think that's very important, and I'm glad to say that in this city of Salt Lake, that I find that it has very solid principles and values. I think that's one of the things that make the city and the state to grow so fast and have these results. The first principle is love. I think love has to be the motor that impulses everything you do. There are several motors in the world, I should say. One of them is hate, too. You see the results of acting on hate are catastrophic for the world. But you act on love, that's the motor who should guide everything you do. Second, fraternity. We feel that all our human beings are our brothers and sisters. Next, solidarity. We feel that the pain of others is our own pain. At least that's what we strive for. Liberty. We respect human liberty. I think that's essential. We don't believe in some systems that in order to accomplish something go against your liberty. I know systems that to get or a lady to get a driver's license have to have a Papa Nicolau, so to enforce to do the exam. It's good for her, I know, but if she doesn't want, I think you have to respect liberty. Tolerance. When you work in a team, you have to tolerate different opinions, different ideas, tolerate diversity. That's also essential. Equity. We believe in more just distribution of wealth and the equality of all human beings. Peace. We want to do in peace nothing by violence. The world has shown, we can talk 1 hour about this principle. The team. You have to look for people who have the same values, the same ideas, and I'm going to tell about some of the characteristics I think the people in the team should have. Integrity, like the dictionary defines, is to being honest and having strong moral principles. If we are to trust each other and trust the health of our patients, we need people of integrity. Next quality would be professional excellence. If you are not excellent in your profession, you don't have the right to give your knowledge to people. So poor people has the same rights that people that pay for your services, and you need to strive for professional excellence. Tolerance and understanding that I have mentioned. To work in a team, you need to tolerate each other. People is different. You need to work together in harmony. Another, to have an adventurous spirit. I think that's very important in the program I'm doing. We are doing unusual things, going to places far away, uncomfortable places to stay. All this needs you to have an adventurous spirit. If you are used to being in your own house, in the commodity of your own living room and bedroom, you are not for the program. And another quality is courage. Winston Churchill used to say that courage is the finest of human qualities because guarantees all the others. I think that's very important. You need to have courage. And you have to have a program. We developed a manual of procedures that has our background and principles the guideline of the pathology we see most frequently, the protocols and checklists in the operating room, so we can be sure that our results are good, and an instructive for all our trips. You have to have protocols, what you have to do in every trip, because you cannot forget anything. When you are away, you have to have everything, and we have lists, and we have to do this. So all this is very important to do. Now, where we are. Well, I just mentioned material resources. I think anybody can talk about what they need, and we needed the mobile unit, the equipment, the surgical materials, and everything that we had to get. It took me about 15 years to accomplish these results since I had the idea. Everything was a series of apparent coincidences, but we finally had all these 4 elements for the program. This is the mobile unit we have. It's a truck that's relatively small. We could have used more space, but the winding Andean roads at that time, especially with very bad roads, made it impossible to use anything bigger. Now we can improve and have something bigger than that. This car has an operating room with all the essential things. You can see our laparoscopic equipment, the light, the anesthesia machine, and everything that needs an operating room. We have traveled in this truck over 300,000 miles. We have been on the high mountains of the Andes. We have go to the coast. We go to the jungle, and have visited 17 of the 24 provinces of Ecuador. Once we get to the place, we park, sometimes next to a mission, sometimes next to a health sub-center, in the slopes of a mountain next to a little village, in the square of the city, or sometimes, as you can see in the next slide, just at the side of the road. Previous to that, we have the local doctors or health personnel, not always a doctor, to pre-select the patients, to communicate when we can, when it's close to Cuenca, we go and we see the patients, and then we program with them. We do a complete history and physical, and we take them to the operating room after getting the informed consent. We do the operation with all the precautions that are usually in surgery. Next, our patients recover in a tent, and that's very nice because the first thing they see is the face of the mother, the father, in this case, the grandmother, because the immigration in Ecuador have left many families in the country at the care of the grandparents. But if the child wakes up and sees this instead of the environment of a recovery room, I think it's more human. We had also this boat that Ray mentioned, and he operated in this boat in one of the tributaries of the Amazon. We financed the boat, and we were able to have a nice family health program based on the boat. That smaller boats went to all the villages around the side of the rivers, and then we got our patients, and we operated it in this boat who had an operating room. We have done, until the end of last year, 7,003 operations, mostly in general surgery because we have a constant team of volunteers in general surgery. In other specialties, we get sometimes help, and we can see, you can see that we have operated on all different specialties. You can see laparoscopic cholecystectomies, open cholecystectomies that we did before we had equipment. Now we do always laparoscopic. We have inguinal herniorrhaphies and other hernias doing the bulk of operations. Most of the operations are in these areas. We use telemedicine for the preoperative period, during the operation, and after the operation. It has been of great help for us. At the beginning, we contacted our patients by telephone. We had a list of patients by fax, follow-up via telephone, and in the Amazon jungle by low-band radio. We didn't know we were doing telemedicine. It was not on style yet. We were doing just to complement our work, to complete our work. And So we used any type we could. This is the computer we had at the base, and this is the laptop we had in the distant places. We had these cameras in addition, but we had used also satellite. When we had visits from the state, we had telephones using satellite that were so expensive. But now we just have a cell phone, what I call cell phone medicine. We don't need to have any sophisticated equipment, and I think that's the future of medicine, a cell phone who can get all the information. Every time you get news about the new things they do, the little chip they put in your blood, like a sand, like a grain of sand, you can get all the chemistry of the blood, you can get through telephone EKGs, you can get whatever information. The future is going to show us how many things can we do with this. Teaching is very important. We are university people, so service, teaching, and research are what we are always keep in mind. We want to teach our students first to perpetuate what we do. The only way to have to continue your program is teaching the young to do what you are doing and inspiring them to do and continue your work. I have been successful in that part. I have a very young team of doctors. As you can see, I have few months, years, I don't know, to keep going on. But one of the people who will continue this is my son, who is a surgeon too. He trained in the United States, practiced for a while here, and just moved back to Ecuador to take charge of the program. And I have people who went with me as students, then as residents, and now are the surgeons at my program. We want to teach them more than anything a human experience. We want them to see how people live, what are the problems they have, and to inspire compassion on their hearts. We have had students, of course, from the University of Cuenca and the University of Azuay, that are the universities I work with, but we have now students from all over the world. We have had most of the major universities of the United States, Harvard, Yale, Stanford, University of California in different campuses, all the universities you can mention, and have also from the United Kingdom, from France, from many countries of Europe, Belgium, Holland, and as far as Australia and New Zealand. So we have received to present about 440 students from these different countries, and they come all the time to visit and rotate in our program. They get credit from their universities, and it's a program we like very much, and for us also it's very enlightening to receive young people from all over the world. We have to do research. Leader projects decided to improve the care we do. We have tried different surgical techniques, different anesthesia procedures, so trying always to improve the quality of our service. We have, as a result, have several publications. We have more than close to 50 publications, mostly in journals of the United States, also Europe and Ecuador. What I find the advantages of mobile surgery. First, patients are taken care in their own habitat. That's very important. They are patients that otherwise probably will have lots of problems getting to a regular hospital. We think that especially children are spared of the anguish of being separated from the parents, many times mistreated at the city, in the hospitals, having to wait for a long time, long lines to get to know, and many times after waiting all day, they tell them, come back tomorrow or come back next week. We go right there where they live, and that makes a big difference of the surgical care. Another important aspect is the excellent results we have had. Yesterday I presented the results, but I just let you know that one indicator is your infection rate. For clean surgery is 0.549, and for clean contaminated, it's 2.8. It's not just because we do things right, but because we think our patients are highly selected. We don't operate on very sick patients. We cannot do it. We operate on patients at ASA 1 or 2, and that also brings down the complication rate. Community participation. When we get to a small town, it's a town program. It's not our program. People has been waiting for us with lodging. They prepare the food. They take good care of us, and they share our program, and we feel that's a program with the community. The simplicity. We have simplified many things. I think us surgeons like to make things look very difficult, very complicated. The operating rooms are situated in the most remote corner of the hospital, and just very privileged people can reach there. Other specialties, even the internists, just look through the window, wave to you, and that's it. Just surgeons get in this sanctuary. And we have pictures, sometimes just the dogs walking by the operating room in the fields, and I think that doesn't make any harm. Also, our techniques every time we do in the easy way. We don't do because it's easy, we do because it's better. Or we don't do because it's cheaper, we do because it's better. But happens many times that what is better is easier and is cheaper. When you do an operating room in a hospital, this operating room costs thousands of dollars every minute. When it's closed, it's waiting for patients, people has to be ready, all the equipment you need, everything. It's very expensive. When we close our operating room, we stop spending. It's closed, and we use just to operate. So the direct cost is very cheap. I spend just about $100,000 a year directly because, you know, we have a voluntary team that doesn't cost. We have supplies that are donated. We are trying to do a real cost study, but the simple way I do is what costs to us, to the foundation, and it's an average of $250 per operation. And we don't talk about the indirect costs, how much costs to the poor people in transportation and lodging in the city and coming back and waiting. So really, really, I think this saves lots of money and makes affordable. The interactions are very interesting to analyze. We have all the time to operate. When we are in the city, we have to run from one place to another. We have all the time in the country to talk to the people, to talk to the patients, to discuss what happened, to make them the right information. And also teaching in this environment is made with more patience. I feel easier to teach when we are in the missions than when we are in a regular operating room. Also, the interactions with the community. I had mentioned before, but the community happen things that never happen in the hospital. All the contact you have with people is extraordinary. Next, and the contact of the families. For the family, share the adventure of surgery with his relative or her relative. Here we can see a mother breastfeeding her baby right after she had an operation. This you don't see in any operating room, I think. Also, esprit de corps that develops in the team. We know that's as important for the patient that the person who cleans the operating room, that in our case is our driver, and cleans and sterilizes the operating room, his job is as important as the surgeon doing the operation properly. Because if we get an infection, it doesn't matter to the patient whose fault it is. So we really share our responsibilities. If I see paper on the floor, I don't ask the person in charge to clean it, I do it. So everybody shares the responsibility. And that creates a very good spirit of the core that really makes working wonderful. Also, we have the opportunity to see the beauty of our country. We have a very small but very diverse country in landscape and people, so we enjoy both. We enjoy the coast, we can see the jungle, in the Amazon, the serenity and tranquility of the highlands on the mountains, on the Andean mountains. Finally, we have room for sort of adventure. Here we are crossing a gorge that's about 400 meters high in this very elemental mean of transportation. There are other mobile programs. I am going to mention very fast this and passing the slides fast. First, we had a program we helped to develop in Honduras. I was an advisor for PAHO there for one-day surgery, and I said, why not mobile surgery? They liked my report and they congratulated me. I said, don't congratulate me, because if you don't do it, it's good for nothing. So they took seriously, and they organized a program, and they sent a team to work with me, and we went back and we operated 43 in the first time we went out. Social Security had a vehicle also, and there are the two vehicles, mine and the one, and worked for a while. The University of Loja in Ecuador had this other program. The Ministry of Health bought 6 of these mobile units. They are not working properly because what I said at the beginning, they first bought the mobile units and now they are trying to do the program and get the teams. We are working with one of these units in one town. We went together. This is the one from New Zealand. You can see the difference. It's a beautiful car. In New Zealand, there is a program that lasts already, started in about 10 years ago, and I think they have already 15,000 operations. And this is the one I found in the United States. I went to San Francisco in 1996, I think. It was the Congress of the American College, and there was this beautiful thing there. They invited me, and they had a sign saying the first mobile operating room in the world. And I asked them, how long have you had? They say, well, we started last April. We have done 37 operations. I think that's beautiful, but I'm sorry to tell you that I have one little operating room. We have done already 1,000 operations. So, well, that's okay, they said. Didn't worry that somebody from Ecuador had another one. Doesn't make any problem. But then went the chief of surgery of Yale and told them, this is not the first, I know another. And went Donald from Stanford and said, this is not the first. And when the editor of one of the magazines and the journals and told, I have an article already. So they worried and looked for me and said, can you mention us in your article? So I mentioned them. This is a beautiful unit. They work, I think, in jails and also when hospitals are being repaired. And this is the one that Mission to Heal, an organization in the United States that's headed by Glenn Gilhot, professor of surgery and international medicine at George Washington University in Washington, D.C. Liked my program. He has been with us 5 times, and we are trying to replicate in other parts of the world, mainly in Africa and Asia and the Philippines. I hope this will work. That's my dream, to have this reproduced in other parts of the world. And he has the clear vision. He wants to take my team, the complete team, including the driver, that's very important, to teach people to do. It's not a matter of going and operating and leaving. We want to leave people to do that, to indigenize the program, like he says. Now, mobile surgery has been, to me, a way to do other things, like I told you. If you do just surgery, you don't solve too many problems. It's very nice. We have operated on 7,000 people, 7,000 families, but the impact on the health of the country is nothing practically. Things are the same. So we need to figure out, and we go to do programs in integral family health. And we think that surgery is a good way to start, because thanks to the immediate results of surgery, impactant results, many times dramatic results, people get confidence on you and believe in you very fast. You go in the morning, they don't know what's going to happen, they are afraid. In the afternoon, they see all the patients doing fine, and you have an open community. So that opens to do other programs. If you do a nutrition program, they don't see the results like in surgery. probably are more important along the years. So we have had, and then, you know, medicine and health is not isolated, so you really need to worry about everything and do a human development program. I won't talk about that. I will just say that's what we think the thing should be. We put health in the middle, not to discuss which is more important. For us, we are in the health field is the most important. An architect can put housing as the first thing for him, but everything is related. Our basic human needs, food, education, housing, communication, excuse me for one of the M's that's missing there, work and productivity and recreation. Everything respecting nature with community participation to make it sustainable, and in liberty. And all this to improve, to get the liberation of human potential and improve the quality of life. That's an example of how we brought the malnutrition down in different ages. In 6 years, we had a program, you can see, in different ages. And we have had programs in education, food production and preparation, work and productivity, and recreation. I want to stress the importance of mobile surgery. I'm convinced that it's really a good program that can be reproduced in other parts of the world and reaches to people that otherwise don't have an opportunity to be attended, to be taken care of. And also use surgery as an opening door for other programs that can cause more impact in the community. Thank you for your kind attention.